come out with that. Today, guys, we actually have a special guest, I believe, but we have our very own Dr. Stephanie Reed that's going to take over the call, and she's going to share with you as she goes, but she's a naturopathic physician. She's the founder of Your Healing Place. That's her office practice, Your Healing Place, and what a tremendous name. And not only that, she's doing a lot to help decrease human suffering in our communities, not just from a professional standpoint, but also from point of being involved with Youngevity and Dr. Wallach's message. Without further ado, Dr. Reed, the call is yours.
Good morning, everyone. We have a very, very special call. I work with a lot of patients with a lot of different diseases, and I'm disconnecting the word. We all know that when there's a disease, there's a lack of nutrition and some other stuff that's going on. But one of the things that I wanted to finally get on was someone who's actually been formally diagnosed with cancer and their journey on that road, because everybody asks, well, can somebody with cancer use Youngevity? And the question is absolutely. So without further ado, I'm going to introduce my very, very special guest, Miss Peggy Carob. Miss Peggy, are you here?
I'm here. Thank you. Good morning.
Thank you so much for getting on the call. You guys listening, you can't imagine how elated I am to have Miss Peggy on the call. She is a phenomenal person. And believe it or not, Miss Peggy, can you just tell us really quickly, what was your profession prior to in your earlier years? What was your career?
I am a registered nurse. And
there you go.
Registered nurse. Yes.
And that's awesome.
I enjoyed working. My last job was working with children as a school nurse. But I've had psych, I've had OR experience, insurance. I've done everything.
Awesome. And that's important to hear. Miss Peggy was a nurse. So, Miss Peggy, tell us what your formal diagnosis was and when were you diagnosed? What year?
I was diagnosed in May of 2013 with multiple myeloma.
And what symptoms that you have that gave you the inclination that you needed to go to the doctors to seek out what was, your problems? What was going on?
Okay, my symptoms first started back in, and I will always remember this date, 12/12/12. And at that time, I had this very sharp pain in my right rib cage area. So I went to the emergency room, and they diagnosed me with anxiety. And they said because I was over 40, they said fat there in 40, and that it's your gallbladder, and it's anxiety, and you need to go see your primary care physician. So I went to see her. And she ran some tests, and she says, well, I'm going to send you to a rheumatologist who said I had giant cell arthritis. She did had the operation for that, too, and that came back negative. But they kept saying that, you have all these other, they sent me to a rheumatologist, a neurologist, a list of doctors. And finally, she said she got some blood work back that said that my M protein was spiked and that I needed to see an oncologist. So May of 2013, I went to see the oncologist, and he stated that I had multiple myeloma. They did the bone marrow biopsy. I thought I was going to die with that, but no, they did that. And once that was completed, he came up with the diagnosis of multiple myeloma.
Okay. And I can imagine that was like a shocker to your system. From your profession, I'm sure you understood the ramifications of the diagnosis. Even if you probably didn't know everything about it, you knew it probably didn't sound good. And what were the treatments that they offered you to deal with this new diagnosis? What did they do?
I knew the symptoms, my symptoms, but what I wanted to say, the treatment that he had recommended, it didn't sound right, but I was pressured on both sides from my family, my husband, and from the doctor to do something now. And so within a week of being diagnosed, I was put on dexamethasone, Cytoxin, Valtrex, and it just totally wiped me out. Then they tried Velcade, and then Revlimid, and then Pomalyst. And then the latest has been the Darzalex, which is an immunotherapy. And, folks, I just want to tell you, each time I thought I was going to die. I couldn't walk. I couldn't talk. I couldn't see. My vision had blurred. My hearing had gone. I was just a wreck. I had neuropathy in my hands and my feet and my knees. I couldn't even walk. I was on the couch. I was a couch potato. And they told me that this is the way I would have to be the rest of my life. This treatment, I could never go off. And if they did, they'd give me a little holiday, but then I would have to come back on medication 21 days out of 28 of the month. And I figured this is no way to live. This cannot be normal. How can anyone even function, or who would want to live like this? And they wanted to put me on antidepressants, and and I was on my bone pain was so bad they put me on OxyContin, oxycodone, and that just made it worse, And I couldn't continue to live like that.
Mhm. So all of the names that you've named in terms of those prescription drugs, were those chemotherapy and antidepressants?
Yes, and radiation. I had radiation also.
Wow.
Which burnt my esophagus too, So I've had both, the chemo and the radiation.
Mhm. And what made you decide to seek out natural healing? I guess number one, the frustration and the total feeling of being horrible all the time what drove it. But what really drove it? How did you find me?
Okay, when I was doing research, you get on, somebody said it was death by Google. I'm on the computer every night, late at night, looking up, researching, and I brought it down to the cellular level. I said, there's got to be a natural way to cure this. God has given us everything that we need, to be healthy. And so one day my friend, Pat, she was going to go pick up some supplements from Dr. Reed, and she said, why don't you come and take a ride with me? I'm like, she says, you got to get out of the house and get some fresh air. So I went to Dr. Reed's office, and Pat had told her a little bit about me, and she said, you will love her. You will love her. You got to go talk to her. So I went to her office, and she took the time to talk with me. And I'm like, really? And everything that she was saying was what I had been reading about it. I'm like, well, this just can't be a coincidence. So right then and there, we did a hair analysis and a nano scan, and she gave me these supplements, and I started feeling better. So I said, and that was the end of, that was 12 of 2013. And as a matter of fact, it was the 30th. And I said, well, this is better for me. I told my doctor I wasn't coming back. And that was it for me. I just knew I was on the right path now. God had opened the door and said, come this way, And Dr. Reed had always said, it's you take away what the body doesn't need, give it what it needs, and hydrate, exercise, and you'll be fine. And pray and I meditate and all. And that's been my journey.
Mhm. Mhm. So, what made you decide to go back on your journey? So, and after 2013 and you started doing so well, something else happened that triggered a scare, and that scare took you back into the chemotherapy loop. Can you tell us about that?
Yes, I ended up with bone pain again, and it was like unreal. And then the doctor ran tests, and he said, "Oh, well, your M protein is spiked again, and so you have to come back. You're going to die without it. You're going to be paralyzed without it." And he said, "You have these bone lesions. You have a lesion on your clavicle." And my clavicle felt like somebody had chewed it up or taken an ice pick or something and chopped into it. And my elbow, my left knee, and my left hip. He said, you have lesions there, and we need to take you to surgery and have them scraped down, filed down, or removed. And I was like, oh, no, I cannot go back that way either. But I ended up we compromised, and I ended up taking therapy, chemotherapy again, which I almost died from that too. It seems like I've done this 3 different times, and each time I've gone on this therapy, I've always gotten so ill that it's like this can't be normal.
Mhm. And so you gave me a call and you said, Dr. Reed, I'm in a state of panic again. What do we do? Yes. And that's when I said, this is what we're going to do. We're going to get on Z Radical. We're going to get on the Youngevity protocol, and we're going to take away the stuff again that doesn't serve you and only give your body what it does. And what leap of faith did you do?
I started on Youngevity and the Z Radical, and continued with the, being hydrated and, meditating and walking and just taking the supplements, and it made a world of difference. It really did. It cut back on the neuropathy. My vision came back. I had to go and get new glasses, and my vision came back. The ringing in my ears went away. My appetite increased. And I'm not crying. I mean, I was so depressed. I was crying. All that stopped. I got a new attitude.
One of the things that is so critical is you took your health into your own hands and you made some decisions. And what decision was that? Did you continue with the chemo, or what happened?
Okay, my last chemotherapy was this past summer. And at that time, it was a new treatment. It's immunotherapy, where they take your T cells and, they're supposed to, enhance your T cells, build up your immune system. But all of the medications that they were giving me, the Tylenol, the dexamethasone, and the other two medications, I can't think of them right now, that was the pre-op, it damages the immune system. And I couldn't figure out, well, if this is supposed to help the immune system, why is it tearing it down? And what happened? My immune system bottomed out. I had no white cells or anything, and I caught a really, really bad cold. They put me on prednisone again, and I told them I can't take prednisone. I broke out in 3 rashes all at once, 3 different rashes. And I later found out those rashes were medication reaction. I mean, my body was on fire. I thought I was going to burn up. My hands were inflamed. The rashes were burning. And I said, that's it. I can't do this anymore. And when I called the oncologist, he said, well, the next medication we have for you is Cariplis or something like that. And I looked up the symptoms for that, and that's worse than all the other medications that he had me on. And so I can't go back that way. I don't want to go back that way. That is death. I know I'm going to die if I go that way. My heart has been damaged since then, and I had a healthy heart, healthy kidneys, and everything when I first started. So I'm not going back down that road. So the leap of faith is the Youngevity and the Z Radical and other supplements, and eating right. I changed the diet. It's more of a plant-based fish and chicken and turkey. And lots of water. Just keep drinking water. And got rid of sugar and all the things that Youngevity, it says, the dirty, what is it called? The dirty dozen or more.
The 12 bad foods.
Yeah, that's it.
Yeah. So can I share the text that you sent me on December the 12th about the Frisbee with your son?
Yes, ma'am.
Okay. So on December 12th, Miss Peggy sent me this text, and it says, Merry Christmas and a healthy, safe New Year. We always send each other well wishes and cards. That's the kind of relationship we've built over the years. And it says, blessings to you. Hello, Dr. Reed. How are you? It's me again. I'm having issues. Help! In 3 exclamation points. But this is what you said. You said, all of my joints are making a snapping, crackling sound, plus my right lower rib area pain. On 10:30, I was throwing a Frisbee with my son, having the time of my life. I waited 4 years to do this. This is 1 month ago. 2 days later, I was getting out of bed. I felt a pop of my right lower rib cage area. Pain level was about a 7. Back in 12/12/12, that is where my troubles became, which led me to a diagnosis of multiple myeloma in 2013. Last chemo immunotherapy was in 2016. Really, I almost died. I quit. I did not panic, but really concerned. I waited a month until there was a burning sensation, same area but radiation to my back, 7 and 8 vertebrae area. Called primary care doctor. They gave me methotrexate 2 milligrams a day, which elevated my blood pressure. Pulse dropped to 44 with a regular heartbeat, short of breath. I stopped taking the dexamethasone. Back chest x-ray revealed no new bone lesions, no fractures or spinal involvement. I have complete mobility, lifting, pushing, pulling. Okay, but I'm guarding right now. guarding my right side. The popping sound of all my joints and rib pain is unnerving. It sometimes takes my breath away, but no nausea, vomiting, BM normal and regular, appetite good, no fever, all blood work with no normal limits. I'm due for blood work this week. Yesterday I stopped all supplements, took Motrin, 400 milligrams, and calling it a day. Any idea what the popping sound and rib tenderness is from? I just want to be normal. I'm sending tons of supplements, change my mainly plant-based diet, yada, yada, yada. So I apologize for the yadas. But what I first said was to her, first of all, thank God that all your tests are completely normal and you have complete mobility. I said, reread what you just sent me. You are healed. What happens is when we have a serious diagnosis, a lot of times we are afraid to claim our healing, especially if symptoms look like the old symptoms. So in Miss Peggy's text, she said to me, no lesions, no fractures, everything is good. I've been able to play with my son with the Frisbee I haven't done in 4 years. I have complete mobility. She gave me a completely good report, but her mindset was stuck on that 12-12-12 date. So when she felt the pain, she quickly went back and associated it with the diagnosis. All of her tests are normal. She's been taking Youngevity, she's doing all the things she did, and the body can heal itself if you give it what it needs and take away what it doesn't. So one of the things that I had to do was I had to write that book, From Panic to Empowerment, because it completely gives the roadmap to pull yourself out of that old mindset to accept your healing, because it's the old mindset that's keeping us sick. And so, Miss Peggy, when I brought that to your attention, how did that open up your eyes?
Wow, it was like a walking through, closing the door behind me and stepping into a new era of life, a new journey. I was like, well, at first I thought, well, nah, this can't be. But you know what? The proof is in the pudding. I'm the pudding.
Awesome. And then what we did was to prove to you that you were healed. What did we do? We did another Vital scan, and we compared your current Vital scan with your last Vital scan, and the results were phenomenal, weren't they?
They were absolutely. I'm still blown away. Yes. All I can do is laugh. I'm still in shock. If I don't come up with the right words or whatever, it's because I'm still in shock. I really am. I'm praising God. I have to give Him all the glory, but I'm still in shock. Yeah.
Well, you know what? I'm not in shock. You know why? Because I believe in the Youngevity revolution. I believe in the message, and the message is so simple. But we have been brainwashed on such a subconscious, subliminal level to believe that different dis-ease states are worse than others. Well, a dis-ease, and I'm connecting the word, is just your body's way of saying, I don't have what I need to sustain and replicate and repair. And because I don't have what I need, I'm just acting out a little bit. And if you give me what I need, I'll get back in line. That's all this message is about, giving the body what it needs. But we've been taught that cancer is such a be-all, end-all, horrible experience. I truly believe in my heart of hearts that it's not the cancer that leads to mortality, but it's all the drugs and the side effects of the drugs, and also your emotional state, your emotions. And I think the word cancer evokes so much fear that we're locked in fear, and the body gets locked up, and we can't heal if we're in fear. And that's one of the biggest things that our society does. It throws us in fear, because if we're fearful, then we are controlled by fear. And if you're controlled by fear, you can be controlled by the medical model that says you must do chemo, you must do radiation. And if anybody has ever seen how debilitating that is, you know for a fact that if you go that route, you can't eat, so you're not getting nutrition. You lose weight, your body becomes toxic, your liver is overloaded, and it just becomes a horrible experience. How can the body heal itself when it's consistently being poisoned? Fear is ravaging the spirit, and the mind is being taken over by people playing tug-of-war with your very life. That's no way to live. But the Youngevity model says there is a way. Just give your body what it needs and let God do the rest. That's all we're promoting. That's it. So when somebody says, can Youngevity cure cancer? The answer is no. But the body can be strong enough to do what it needs to do, and the cancer will go away, or it can go away, or the blindness can be restored, or all the things that Miss Peggy just shared with you that she's been able to regain has been restored. It doesn't get any better than that. And that's why this is a revolution. One of the most important things that I'd like to bring to the forefront is the pain that you were having, Miss Peggy. We figured out it was a very interesting thing, wasn't it? I said, you know what? I have a doctor, Dr. Willie Richardson, who's phenomenal at what he does. I bet you from what I learned from him that your pain in your rib has something to do with your mouth. She says, oh, my goodness, you're right. I just had my teeth done, and I'm waiting for some teeth work. And I said, I'll tell you what, let's call Dr. Richardson and see what happens. So what I did was I called Dr. Richardson, and I didn't patch in Miss Peggy on the three-way. I just wanted to communicate with him, get some feedback from him, and then what did you do, Miss Peggy? What did you do?
I went to see Dr. Richardson, and
there you go.
While I was in the chair, he said, here, he put this stick in my mouth, and because my jaw is misaligned, and when my jaw was realigned, the rib pain went away. And I'm like, no way. The whole body is connected. And if we're still I'm still stressed and panic and fear, running around in this little circle, And Dr. Reed said, you have to step back from that, let all of that go. And when I let that go and went to the doctor to see Dr. Richardson, that pain went away. So I now have to get an apparatus for my, my jaw at night. But, now we know what the problem is. But, what bores me is that if my diagnosis back in 2012 was from being misaligned and not giving my body, because I was eating bad. I had a bad diet back then and, working and whatever, stressed out to the max. But now that is behind me, I'm thinking, well, what if all it was that I was misaligned and didn't have the proper nutrients? But then I went through this journey with all this chemo and toxic stuff that didn't work, that could kill me. It's like instead of dealing with not the symptoms and throwing medicine at it or a poison at it, but to give the body what it needs. So I am a firm believer, take away what you don't need and give it what it needs and leave the rest up to God.
Mm-hmm. And so the last question is, how important was it for you to learn how to reflect, reframe, renew, and how has From Panic to Empowerment facilitated that for you?
How did that facilitate? Not to fear. I was very fearful, and to the point where I was insecure about everything. And having that empowerment, it just opened up a new set of eyes for me to see the world in a new phase, a new way. And it's taken all the things that the Bible says that we should do, and it really works. I'm here. I'm a living testimony.
Mm-hmm.
Yeah. People don't believe that I'm sick, but they say you don't look sick. But I think that new mindset, not letting people walk over you and just laying down and let the devil say whatever and believing what he says, it totally transformed every transformation for me.
And so you've been with me since 2013. We're going into 2017. And I'm very, very grateful that you were able to not only trust yourself to do something different, but to trust the recommendations that I was offering, because it's always up to you whether you're going to accept the recommendation. So I'm very grateful that you did, because you've taught me that what we have to share with each other is very beneficial. And if we don't share it, we don't know how we can help someone else. And so I wrote the book From Panic to Empowerment for patients to see the connection of spirit, mind, and body in their whole complete healing transition, and I pray that it was also one of the things that created that shift for you.
Yes, it is. And I agree. I agree wholeheartedly. And I thank you so much. I'm deeply indebted to you. I'm so glad that you were there for me. You're always there for me. You're just a text away, and I just thank God for you. I really do. I really, really do. And Youngevity and Dr. Richardson and I give credit to my pharmacologist, my pharmacist, and the oncologist, because that just opened my eyes up to what I don't want to do. So I think everybody's in your life for a reason, and that taught me a big lesson. Trust God. Trust what He has. The supplements and the diet and all of that. Trust Him. And if you're in a panic state, you're going to listen to the other side, which is what can kill you. It really can.
Well, Ms. Peggy, thank you for allowing this interview, this conversation to be public. And thank you for sharing your journey with me. Because when people come to see me, first and foremost, I never say that I do anything. I just kind of give recommendations based on what I see that you need. I pray about it. I ask God, okay, God, help me with this one. And even society has made me fearful in working with people with your diagnosis. But when you dial it back and you just understand that all diseases are mineral deficiencies, then it's not about me. It's not about what I know. It's about what we know that the body is capable of, and just following that in a sacred way. Our bodies are sacred, and we should take care of them because it's the only ones we're going to get. And so, again, thank you for allowing me to walk this journey with you, because now I am not fearful or panicked about helping people with your diagnosis, because it has nothing to do with me. My job is to just open up the door, present a path, and let the person see what their own potential is. And you've proven that, and I'm so very grateful. So I'm going to turn this call back over to Dr. Richardson, and thank you so much for sharing your story.
Wow, Dr. Miss Peggy, that was awesome. You guys have really blessed someone this holiday season. Many people will be blessed by your testimony, Miss Peggy. Many people will be blessed, Dr. B, by what you're doing. And guys, we're just starting. That's what this journey is all about. So we appreciate you.